At this point in time in the U.S., the Orbera intragastric balloon is not covered by insurance. And that's sort of the way surgical technologies go when they come out and the advent of it until they get more of a track record in the U.S. and insurances clearly see the value per se. This happens with everything we do, that there is that gap. So there clearly is a cost involved. And I want to make sure that people understand that there is a cost involved, and we can go through the numbers later if they want. But more importantly is, what do you get for the numbers? Most importantly is that there's no one that's tried to notably lose weight and is considering an endoscopic option like this that doesn't already spend real money on weight loss, whether it's technologies, whether it's care, whether it's training, whether it's medications, whether it's quality of life things that really cost you money, what you spend on foods and technologies. So we want to take that into consideration and make sure people get a real value. For us, what you get is you get my surgical and medical management with multiple visits and as needed consultation with me. You get our in-office dietitians. You get our behavioral people that help you understand the role of diet and exercise in your life. You also get our endoscopy procedures and the balloon itself. So all of that over the course of a year, dollar cost average, which you have to understand if you can afford that, if it's reasonable for you, turns out to be a very reasonable option. I mean, and the reality is, if people can regularly afford and pay for bariatric surgery, which is more expensive, this is actually a much more economical option. And the fact that it's a non-surgical option for a lot of people has a real value added, and will help you determine whether it's right for you or a reasonable cost outlay.